Buddy, my name is Ed Gristar. I'm on the steering committee of a national single payer, and we're pleased today to announce one of our webinars that we have once a month. And this evening, I'm going to just introduce to you a little bit about National Single Payer. We're a national group that works for healthcare as a human right on a national level, but we actually are organizing locally in attempt to building a grassroots coalition will help change the balance of power to achieve our goals. We hope that you enjoyed this webinar. We hope that you register for our upcoming events that we have. It's all on the website. And as far as this evening, uh, there's a chat, and would like you to introduce yourselves in the chat so the other participants can see who is on the call. And keep your conversations to a minimum, and be civil and courteous to the other participants. And if you have interactions after the participants and our guests have made their comments and give their presentation, you'll have an opportunity to ask questions. So when that occurs, you can unmute yourself, and you will be asked to give your questions so that we can hear what you have to say and questions on the issue. So with that, I want to thank you again for joining. Hope you join National Single Payer. And I'm going to turn it over to Claire Cohen to introduce the participants.
Okay, good evening, everyone. Nicaragua stands out as a shining example of universal public health in Latin America. To help us better understand how critical universality and equity are to a healthcare system, we have three speakers tonight. Our speakers will discuss the evolution of Nicaragua's public health care system over the past 50 years, including healthcare under the Somoza dictatorship, eradication of children's illnesses with the Sandinista Revolution, regression under neoliberal government, and restoration of rights to quality healthcare since 2007. We hope that as a U.S. audience, we can take these hopeful lessons and apply them as we create a new healthcare system right here. Our first speaker tonight will be Becca Renk. Becca Renk is originally from Idaho and has been living and working in sustainable community development in Nicaragua for the past 25 years. Becca has organized hundreds of volunteer medical delegations to Nicaragua, was the administrative director of a community health system in Nicaragua, managed a public health promoter program, and accompanied patients navigating Nicaragua's public health system. She is the coordinator of Casa Bin Linder in Managua and is active in the Nicaraguan Solidarity Coalition. Our second speaker tonight will be Kensy Sambola. Kensy Sambola is a Nicaraguan Garifuna anthropologist originally from the Garifuna community of Orinoco. Sambola has distinguished herself for her deep knowledge of her people's cultural rituals and beliefs. She is one of the few Garifuna people to have conducted scientific studies on her culture. Sambola has collaborated with the Nicaraguan Institute of Culture, contributing to the dissemination and protection of Nicaraguans' cultural heritage. In addition to her academic work, Sambola is the owner and manager of Hostel Garifuna in Orinoco, and an agroecological farmer with a focus on helping new generations learn traditional plant medicine of the Garifuna people. Her work reflects a commitment to preserving the traditions, religion, and history of her community, integrating anthropological research with the daily life of the Garifunas. Our third speaker tonight will be Stephen Sefton. Stephen Sefton is a community worker and writer who has lived in Nicaragua since 1994 after visiting the country in 1986 and 1987, when he worked building school classrooms in Cardenas and houses for disabled soldiers and their families in Managua. Since 2008, he has coordinated the Tortilla Consal Media website, offering information in Spanish and English about Nicaragua and the wider region. He is a member of the FSLN political party and received Nicaraguan citizenship in 2001. He currently works half-time on community education and health programs in Esteli. Are we starting with Becca? Becca, you okay?
Hi, everyone. Thank you so much for inviting us to be with you here tonight. I'm going to share some slides. We'll start our presentations tonight with telling you a little bit about the background of the Nicaraguan healthcare system. To start, we'll go back to the period before the triumph of Nicaragua's popular revolution in 1979, when the country was ruled by the cruel Somoza dictatorship. The Somozas, educated at West Point, were installed in the 1930s and propped up by the United States in order to further U.S. business interests in the country. The dictators enriched themselves and their cronies while exploiting and impoverishing the Nicaraguan people. During this time, Nicaragua's public healthcare system was recognized as being one of the worst in all of Latin America. 90% of public health resources were consumed by just 10% of the population. The most common causes of death in children in the 1970s were all preventable diseases: diarrhea, tetanus, measles, and pertussis. 1 in 10 children died in the first year of life, and more than half of all Nicaraguan children were chronically malnourished. Public health programs covered only 20% of women and pregnant women and children under 5 years old. Resistance to the Somoza dynasty began to coalesce in the 1960s with the emergence of the Sandinista National Liberation Front, or the FSLN. Even before the revolution succeeded, the FSLN wrote out its vision for Nicaragua in its 1969 historical program. Today, this document continues to guide the work of Nicaragua's Sandinista government. In its plan, the FSLN stated that its revolutionary government would provide free medical care to the entire population, that it would establish clinics and hospitals throughout the country, and that it would launch large-scale campaigns to eradicate endemic diseases and prevent epidemics. Carrying out this work, however, has required a monumental effort. In the 1970s, the insurrection to overthrow the dictatorship left 50,000 people dead and the country's infrastructure destroyed. At the end of the dictatorship, there were only 209 health units, that's hospitals and health centers combined, in the country of more than 150 cities. With the triumph of the revolution in 1979, the new Sandinista government, following through on its historic program, made healthcare free for all. Healthcare was revolutionized, with former prisons and bordellos being converted into health centers, with countrywide vaccination campaigns that eradicated polio and other childhood illnesses, and 15,000 volunteer brigadistas or health promoters to carry out this work and teach preventative care. Nicaragua's health transformation, however, was complicated by the Contra War, which started almost immediately following the triumph of the revolution. The Contras were guerrillas trained and funded by the United States who used terror tactics against Nicaragua's population. Rather than attacking military targets, they attacked the gains of the revolution: free education and free healthcare. The Contras killed teachers, nurses, and doctors. They committed war crimes such as blowing up bridges and hydroelectric dams and placing mines in Nicaragua's ports. Although the Contra War lasted nearly 10 years and left 50,000 Nicaraguans dead, the Sandinista government remained committed to improving access to healthcare for Nicaragua's people. The revolution managed to increase health units fivefold. By 1990, there were 1,056 units. In the lead up to the 1990 elections, the U.S. promised to continue its Contra War unless the people elected the U.S.-backed candidate. As a result, Nicaraguans went to the polls and chose peace, entering into a stark 16-year period of neoliberalism, where the rich got richer and the poor got even poorer. During this time, education and healthcare were effectively privatized. Even when patients managed to be seen by a doctor, they were given prescriptions for medicines they couldn't afford. Patients unfortunate enough to need surgery had to bring their own alcohol, gauze, sutures, medicines, IV fluids, and sheets, as well as family members who could donate the blood they would need. Laboratory tests, specialized treatment, and surgeries were so expensive that poor families effectively could not access the service. During these years, patients literally died on the street outside of hospitals for lack of basic medical care. More people died due to lack of food, healthcare, and work than there had been killed in the Contra War. From 1990 to 2006, neoliberal governments only managed to build 35 new health clinics, the majority of which were in rural areas and sat empty due to lack of personnel and materials. After 16 years of governing from below, organizing with grassroots community works, labor unions, women's, students, and peasants movements, in 2006, the FSLN was voted back into power. Their first act as the government of reconciliation and national unity was to declare healthcare and education free again. Nearly 20 years later, access to quality care is no longer the privilege of a few, but a right that has been restored to all Nicaraguans. This has been achieved through public investment in health infrastructure, an increase in personnel, improved and specialized training, and tireless work to involve communities and families in their own healthcare. Nicaragua's universal free healthcare system is organized on family and community-based model, which has revolutionized the culture of the country's healthcare system. Nicaragua has made a long-term financial investment in public health. Social spending is nearly 5 times what it was in 2006. In 2026, 53 cents of every dollar the government spends on social programs, 53 cents of every dollar the government spends is on social programs, with healthcare alone representing 14.5% of the country's annual budget. For those of you in the United States, I will note here that Nicaragua's military budget is only 3%. The investment has included major infrastructure improvements. 47 hospitals have been built new for a total of 79 hospitals in the country, making Nicaragua's the largest public health network in Central America. There are now 1,742 total health units, hospitals, and health centers, all of which have been built new or remodeled since 2006. Additionally, Nicaragua's public system has 191 natural medicine clinics, 105 special needs centers, 76 mobile clinics, 74 pain clinics, 52 mental health clinics, and 3 centers to treat addiction. Over the past 2 decades, additional healthcare personnel necessary to bring improved services to the country's growing population has been made possible through an extensive network of free public education, preschool through university. Even medical school is completely free in Nicaragua, as well as specialty training. In 2006, there were 3.7 doctors for every 10,000 people, and half of those were concentrated in the capital of Managua. Today, the Nicaraguan public health system has 9 doctors per 10,000 people, and also has 8 registered nurses, 8 LPNs, 10 medical technicians for every 10,000 inhabitants. Nicaragua's successful healthcare model turns on the axis of community health workers, a network of 74,629 brigadistas or health promoters, lay midwives, volunteers, curanderos, shaman, and traditional health practitioners. These health workers carry out activities to eliminate these community leaders are the eyes and ears of the Ministry of Health on the ground, helping to connect patients to the public healthcare system. These health workers carry out activities to eliminate mosquitoes during dengue outbreaks, do contact tracing during epidemics, and lead the annual door-to-door vaccination campaigns. Thanks to their work, Nicaragua's vaccination rate against childhood illness is now up from 88% 20 years ago to 95%, and protects against 18 illnesses instead of just 10 illnesses covered in 2006. One clear example of how healthcare has been revolutionized in Nicaragua is the care of pregnant women and their babies. Let me say that while I've been thrilled to see pregnant women in Nicaragua get healthier, I've been dismayed to see corresponding maternal mortality rates in the US rise in recent years, to the point where women in Nicaragua are now more likely to survive pregnancy and childbirth than women in the US. In 2025, maternal mortality rates across the US were 17.5 deaths per 100,000 live births, while Nicaragua's maternal mortality rate was 16. And I will note that in the US, the rate of maternal mortality for Black and Indigenous women is 3 times higher than it is for white women. So how is it that a third world country like Nicaragua has better maternity care than the richest country in the world? The answer is that the Nicaraguan government has the political will to care for pregnant women and their babies. 87% of all maternal deaths are entirely preventable. Nicaragua has decided that maternal deaths are an unacceptable outcome. In order to prevent deaths, all prenatal, childbirth, and postnatal care in Nicaragua is offered countrywide, free of charge. C-sections, premature births, neonatal ICU stays, and incredibly, even fetal surgeries are all free. Home births, previously common, especially in rural areas, are now unheard of. 98.8% of all births take place in the hospital. Lay midwives who once attended home births have now been incorporated into the healthcare system to provide prenatal support in home communities and in-hospital support during births. For families still living far from hospitals, there's a network of 182 maternal wait homes around the country, which care for more than 70,000 women per year. Nearly 75% of all pregnant women spend the last 2 weeks of their pregnancy in one of these homes, resting, eating healthy food prepared for them, and being monitored daily by health professionals before giving birth in the hospital. Through family and community involvement, strong support systems, and ready access to all levels of care, Nicaragua has achieved an 82.8% reduction in maternal mortality over 20 years. Nicaragua has also achieved a 63.17% reduction in neonatal mortality rates since 2006. Thanks to lay midwives, well-equipped maternal fetal clinics, and the maternal wait homes, Nicaragua has also reduced premature births by 24% in the past 12 years. In 2021, Nicaraguan doctors became the first in Central America to learn and perform in utero surgery on fetuses to correct life-threatening conditions like spinal bifida before birth. By the end of 2025, 545 surgeries of this type had been performed free in the Nicaraguan public healthcare system. I'll conclude my remarks there. Thank you very much.
Next is Stephen.
I believe it's going to be Kensy, correct? Kensy.
Next is Kensy.
Thank you for this invitation. I think after Rebecca, I don't know what I should say. But I will share some of the lessons, and I don't live in the rural area. I think we can share some experience so we can know that what she's saying is a fact, that Nicaragua really, in our country, healthcare is a priority, it's a matter. It's something that matters for everyone, and it's not a privilege, but it's a right for every Nicaraguan, but not just Nicaraguan. It's for every human being that is in this country. If you got sick, you don't have to worry if you have money or not, because you're a human and you will be taken care of as if you're Nicaraguan. So I'll be sharing a little bit of these lessons that we have learned. For example, talking about the universal coverage. We'll be talking about healthcare, equitable distribution, the community health center, integration of primary care, the investment in health, which I think Rebecca showed very good. She it showed that clear images of how that had been placed in Nicaragua. The community participation, health, education, and promotion in this matter. When we talk about universal coverage, we're saying that Nicaragua healthcare system is one of the most universal in the world. We strongly believe that as Nicaraguan. It provides free quality healthcare services for all Nicaraguans, regardless of their income or social status. Everyone has access to essential healthcare services, including providing curative and rehabilitative services. As I said before, is not a privilege. Healthcare in Nicaragua is a right for every human. For Nicaraguan, but every human. So people who visit us, they are treated the same way. I think who come to Nicaragua and have got the chance or have got the experience know that they are treated such as if they were Nicaraguans. For some people, it's even strange. I had got the experience of having a other Garifuna from Central America visiting us and they got sick. And when we take them to the hospital and they attend them, then they ask for the bill and they said the doctors would tell them, no, you're in Nicaragua. They say, how can a poor country afford this? I think there is a lot of love and we look out after each other. So we have learned that from our leaders, Commander Daniel and Rosario, every day preach love and that's a must in the heart of Nicaraguan people. So we try to make this be equitable. I have an equitable distribution. In Nicaragua, it is designed to be equitable. It aims to provide equal access of healthcare services to all Nicaraguans, to everyone, as I repeat. No matter the geographical location, gender, or social class. This equitable distribution healthcare resources help to reduce health disparity and to promote health equity. In 1960, in Nicaragua, we had 26 private hospitals. From 2007 until now, we have 79 public hospitals, as it was mentioned. We have 230 health centers, 1,742 communal health clinics, and 180 maternity waiting homes that are very, very important for the people who live in the rural areas. Because in our health centers, we have doctors, in the health clinics, you have nurses, and it's a big network, really connected one to another to save life. And it goes beyond just the health system, because when there is a situation with a patient, there is a full involvement of leaders, of community participation. So in our case, as we live, I live in Orinoco, the only way to get out here is by boat. If somebody gets sick, is more than responsibility of the doctor to make sure that patient reach to where they need to be to get the proper attention. So it has a full community involvement. These centers play a crucial role in providing preventive care, early detection of diseases, and health education. When we talk about integration of primary health care, we're saying Nicaraguans' healthcare system emphasize the importance of primary care. Primary care services integrated into the healthcare system ensure the patient receive comprehensive care from a single provider. You know, our system here, every public system is on the Ministry of Health, and we all work around. We work around that as most of the people. We think that the best services in this country is in the public area. Who want to go private, you have the option, but we think that the public services is of the best in this country. This approach helps to improve health outcomes, reduce health costs in our communities and in our country. Investment in health. Nicaragua has consistently invested in healthcare system. Despite being a low-income country, Nicaragua has managed to provide a universal healthcare service. This investment in health demonstrates the importance of prioritizing health in a national development plan. As I mentioned before, there is a full participation of the community in all of this. In our healthcare, we ensure community part. It encourages community participation. Local communities are involved in the planning, implementation, and monitoring healthcare services. Healthcare services are culturally appropriate in our system, in our government system. In the health, it's very appropriate. It is set to the community needs, and this make it a sustainable way of carrying our health programs. In Nicaragua, when we talk about health and education and promotion, Nicaragua places a strong emphasis on health education and promotion. The healthcare system provides information and educate the population of various issues that prevent in preventive action. Like it was mentioned before, the health centers are medical, or the whole education of health, the whole health system is not just into the health center, but it go beyond. You find nurses and doctors visiting homes, making sure that people have their vaccine, that they're participating in every one of the programs to make sure they have they can take right decision and making proper decision on their health care as a person. So they would visit daily. You can find nurses out on the road making sure if it's vaccine for COVID, if it's vaccine for whatever vaccine they are out there. If you don't come to the health center, they're making sure they find you wherever to give you the information, and so you can make a right decision. And if you want to take your treatment, you will also have it. Is in years gone, we had a lot of people dying out for tuberculosis, I think that was one of the things that Somoza inherited to the people. And today, that is practically eradicated. And if anybody happened to appear with that sickness, no matter where you are at the Ministry of Health, make sure that your medication is to your door. So they visit that patient until that patient get well and making them have their medication. As Nicaraguan, I think we are very proud to say that our healthcare system offer valuable lesson on importance of universal equitable healthcare. Our ancestral traditional medicine on the Caribbean coast of Nicaragua is protected by law. It recognizes and guarantees the right of indigenous and Afro-descendant people to practice and to transmit their health knowledge. This legislation aims to integrate these practices with the national health system, protected collective intellectual property, and to ensure the cultural relevance into medical care. For us in Nicaragua, health is understood to be a balance between the body, the spirit, the community, and nature. Our healthcare demonstrates that with a right policies, investment, and community engagement, it's possible to provide comprehensive health services to all members of the society. We as Nicaraguan, as I say, we are happy, we are proud, and we are very grateful to our leaders, Commander Daniel and Rosario, for re-establishing the right of the people in this matter. I'll stop there and thank you very much.
Okay, thank you very much. Oops, there we are. Kensy. Next is Stephen. Go ahead, Stephen.
Well, thank you very much, Claire and Anna and Ed and Judy for inviting me to take part in this. Vamos a ver si puedo compartir. It's not letting me share my screen. I don't know why. Compartir, ventana. Ventana, compartir. Yeah, I'm sorry about that delay. I had difficulty sharing the screen. So thank you very much for inviting me to take part in this webinar. And thank you very much to Becca and Kensy for their presentations. I hope I'm not going to repeat a great deal of what they've said. I think some overlap is inevitable. I'd like to base my presentation mostly on the personal experience I've had since visiting Nicaragua in the late 1980s and subsequently over 30 years since 1994, during which time I've had constant interaction in one way or another with Nicaragua's public health system. And Becca has already noted how Nicaragua's public health system prior to the change of government in 2007 was extremely badly under-resourced. And she talks about it being privatized. In fact, it was very much on the verge of being completely privatized. And in my opinion, at that time, 2006 or so, it was providing much worse care than the care that was being offered in the 1980s, even at the height of the war here in Nicaragua. And my experience as a community worker during the 1990s and early 2000s, during the time of the neoliberal governments, involved organizing visiting medical brigades from overseas, mainly in urban barrios and especially in rural communities. And also I was very involved in trying to support the system of casas maternas, the maternal hostels that Becca was explaining in her presentation, where women go in the few weeks prior to their giving birth. And I've generally worked especially with grassroots volunteers, the brigadistas, who have struggled to sustain, at that time, prior to 2007, they were struggling to sustain basic community care in a public health system that essentially was exploiting their commitment, their personal commitment. And especially, for example, during mass vaccination campaigns, in terms of sustaining their maternity hospitals, and in a context where the health system was denied an adequate budget. So I'd say it's absolutely clear to me that the declaration by President Ortega in January 2007 that the health system would provide free universal health care again revolutionized healthcare in Nicaragua as emphatically as the revolutionary triumph of 1979 had done. And in my opinion, the three main sections of the population that have benefited most from Nicaragua's universal free healthcare system are mothers and young children and patients with chronic illness, especially cancer patients, and children in general. Becca and Kensy have already spoken about mother and child healthcare. And Kensy has talked about the health system's focus on community care and prevention. And this, in the case of patients with chronic illnesses like diabetes, epilepsy, hypertension, asthma, HIV, arthritis, heart or kidney conditions, autoimmune diseases, and especially different types of cancer. This system offers indispensable support because municipal health centers and community health posts seek to identify chronically ill patients. They incorporate them into a system of regular periodic care so as to manage their condition as best as possible. The system tries to ensure that all these patients with chronic conditions have ready access to the medicines they need, and they also make sure that they get regular visits to their specialist in the public health system. And over the last 3 years in particular, MINSA has been training local health volunteers, these brigadistas, to help identify patients with chronic conditions as part of the integral preventive care model of Nicaragua's public health system. They've specifically been focusing on that. And these brigadistas are absolutely vital in ensuring the success of Nicaragua's preventive community-based healthcare model. They make possible massive house-to-house education campaigns, and for example, as well, campaigns to control mosquito-borne diseases like dengue. And during it may be worth noting that during the COVID-19 pandemic in Nicaragua, with a population of, at that time, just under 7 million people, the health system mobilized all the 70,000 brigadistas, as well as over 30,000 of their own healthcare personnel, to undertake, I think the total was just over 5 million house visits to try and educate people about COVID and keep track of patients that may have contracted that virus. So the brigadista system is absolutely essential to Nicaragua's public health system. So then, and you can see in these slides the healthcare workers from MINSA and brigadistas visiting houses to fumigate against dengue and to put an anti-malaria a material that acts against the mosquito eggs in domestic water sources. So in recent years, another aspect that perhaps we should pay special attention to is the way in which the Health Ministry has implemented outreach activities to reinforce the grassroots work of the brigadistas. And among these activities, there are massive day-long health fairs, so-called ferias de salud, which translates in English into health fairs, just day-long mass health activities, which involve the deployment to a specific place of dozens of specialists, medical personnel, as well as laboratory testing resources and support staff to serve a given community. And in that day, they'll see hundreds of patients, ensuring that they get the specialist care from specialist consultants that they'd have difficulty otherwise getting if they live some way away from the health center. And so, as well as these specific days of so-called health fairs, MINSA also implements a program called Mi Hospital, Mi Comunidad, my hospital, my community. This is a program that's not as intense as the day-long health fairs, but also involves specialists from local hospitals going out to rural communities to make sure that specialist care does reach people in rural communities that might otherwise have difficulty getting into the health centres and the hospitals. So then, sorry, having difficulty with my focus here. So then the other thing about that is, oh yeah, let me go back to that previous slide. And another integral part of these outreach activities is the deployment of mobile clinics that are comprised of big articulated trucks that are actually trucks that have been converted after being confiscated by the authorities in the course of anti-narcotics operations. So they'll seize a truck in an anti-drugs operation, and then that truck gets converted into a mobile clinic to serve the outreach activities of MINSA. And these clinics make it possible to deliver good basic conditions, providing care where there's either no health post or where the health post is too small to accommodate the number of patients needing attention. And this outreach system readily accommodates visiting medical brigades. My experience has been over the last three or 4 years that a visiting medical brigade that comes from Boston every year is able to coordinate very closely with the local health authority here. And they ensure that our visiting medical brigade actually gets support sometimes from specialist consultants, usually with dental care, and always with basic laboratory facilities and almost always an ultrasound. So this community-based system of grassroots participation in the delivery of healthcare that Kensy would explain so very well is coordinated with the country's hospital system, which is by far the most extensive in Central America. Becca said that the figure that she offered was 79, and that's a figure from last year. It's actually 82 hospitals now, as a result of the incorporation into the system of 3 new hospitals this year. So the country now has these over 80 hospitals, including national reference hospitals, regional hospitals, departmental hospitals, and local hospitals, as well as centres for specialised attention in dermatology, ophthalmology, cardiology, psychiatry, addressing problems with audition and speech. And of special importance are these are photos of the recently inaugurated Children's Hospital here in Esteli. State of the art and specially designed to cater for young children. So then of special importance are the Nora Astorga National Radiotherapy Center and the National Oncology Center, named after Dr. Juan Ignacio Gutierrez Sacasa. And these centers provide treatment and surgery relating to all kinds of cancer. The Nora Astorga Center has 3 linear accelerators, and all these services provide their care free of charge. All these hospitals, all these centers, they all have well-equipped clinical laboratories, and Nicaragua has a very highly regarded diagnostic center and molecular biology lab in Managua that apparently is of a standard that's only matched by a similar laboratory in Mexico. And there are many recently completed hospitals, including the very important Oscar Danilo Rosales Teaching Hospital in León, which is, I understand, is Nicaragua's largest hospital. And a major teaching institution in the country. And I think it's also the largest such hospital in Central America. Other recently completed hospitals include a very important hospital in Bilwi, serving the Northern Caribbean coastal region. I think it serves a total, it's able to serve the local population, I think is between 70 and 90,000 people in that area. There's also a new hospital in Chinandega, in Ocotal, that children's hospital in Esteli. Managua is well served by several very highly regarded hospitals, and the hospital system is also complemented by the social security system hospital, the main hospital of which is in Managua. It's called the Hospital Solidaridad. And around the country, there are in every department, there are social security clinics serving patients from the social security system. And also very important for us here in Nicaragua is the military teaching hospital named after Dr. Alejandro Davila Bolaños, who was martyred in the fight against the Somoza dictatorship. And that hospital is, it's regarded as probably the most advanced in the region. So there's also planning to enhance even further Nicaragua's hospital system, and those plans include a massive hospital in Managua with over 500 beds, and also a new hospital for Bluefields, which will probably be of great importance to Kensy and her community. And that's going to be designed specifically to serve the area of Bluefields, and it'll be named after the Afro-Caribbean and original peoples of the region. So international solidarity has always been very important for Nicaragua. For example, I remember that for many years, Italian hospitals offered much needed cardiology care and surgery for Nicaraguan children before Nicaragua was able to develop its current level of advanced surgical skills. And during the COVID-19 pandemic, Chinese and Russian solidarity helped MINSA address vaccine shortages when Western governments essentially neglected the needs of many countries in Latin America and the Caribbean. Cuban doctors made possible the mass provision of ophthalmology care, and they continue doing that in the so-called Misión Milagro, Mission Miracle, which has been a huge success in Nicaragua. Across the region, it's served well over 2 million patients, restoring their vision. And here in Nicaragua, since 2007, the total number of patients who've had their vision restored here in Nicaragua is over 360,000. So that Cuban medical cooperation with Nicaragua has always been constant and consistent, right from the very early years of the first phase of the revolution. And during that time, there have been medical brigades of all kinds from the United States and from European countries, and for which people here in Nicaragua are very grateful and very happy to acknowledge the huge contribution that these brigades have made and continue to make as a contribution reinforcing the specialist care here in Nicaragua, and also facilitating the exchange of experiences between medical professionals from other countries and our own medical professionals here in Nicaragua. And currently, perhaps the most important area of international cooperation is the development with Russia of nuclear medicine in Nicaragua. And the government is about to start work on a nuclear medicine center, which will have a cyclotron to produce the isotopes that are used in cancer treatment. Russia is also helping Nicaragua, including the country, in the clinical trials for vaccines that are being developed in Russia's medical system to combat certain kinds of cancer. And I think they've also developed a vaccine against dengue. And in addition, Nicaragua also has important agreements with India and China for the purchase of medicines of all kinds. And in fact, I think in the case of India, Nicaragua and India have harmonized their medicine protocols to make the exchange of medicines, to facilitate a more fluid exchange of medicines between our two countries. So thank you very much. I hope these comments have served to complement the presentations made by Becca and Kensy. Thank you very much for your attention.
Well, thank you, Stephen and Kensy and Becca. Those were all just wonderful presentations and an enlightening look at what healthcare is doing in Nicaragua. It's fantastic. And you probably couldn't look at the comments in the chat while you were presenting, but lots of really positive feedback. So what we,
Can I interrupt for just a second? Stephen, would you mind, there, thank
there
you.
you go. What we try to do in these webinars is allow our participants to ask their questions in real time. Although you don't have your videos on, you can speak. And so in order to do that, you have to raise your hand so that we can call on you. Meanwhile, a number of questions have been placed in the Q&A, and if those people would like to ask their questions verbally, please raise your hand. In the meantime, I can start with a couple of those questions that are in the Q&A right now. I haven't seen any hands raised yet on our raised hand function. So I will start with Jill's question for Kensy. She asked, could Kensy please give an example or two of how intercultural healthcare is provided in the Garifuna community? That is, examples of traditional medical practices intertwined with Western medicine. Thank you. So Kensy.
I think we have many examples of those.
Kensy, could you speak up as much as possible?
I think we have many examples, so I can share. For example, I would tell you that, for example, if a snake bites somebody and they go to the health center will attend the patient, but the patient will immediately ask for the traditional doctor assistance. So the traditional doctor go to the health center, and together with the Occidental doctor, they attend that patient. Once that was not permitted, now that is completely normal. If there is a person who's going to give birth at the health center, and they feel like they would like to are the hospital, and they feel like they want the midwife to come in, they can go in as normal and accompany the process. So we have people who might have joint problem or muscle problem, and they're doing therapy. And if they want to bring a traditional doctor to accompany them, it is totally permitted. I would say thanks to the law that we have in Nicaragua, that is permitted, because without the revolution, we couldn't even think about this. This is Pharaoh's achievement from the revolution.
Thank you. So I'm going to go back into the Q&A since people aren't raising their hands. This is from Marcia. She has a question about expensive care for diabetes technology. As a diabetic herself, very dependent on a continuous glucose monitor, how does Nicaragua handle that kind of maintenance? And whichever of you speakers could speak to that would be great.
Stephen, you're muted. But yes, please answer, Stephen.
Sorry, Judy, I missed the first part of that question.
The questioner is asking about diabetes technology and how Nicaragua handles the kind of maintenance such as continuous glucose monitors.
Well, I'm not a doctor, and I only know from our experience of helping people that have diabetes locally, and so most diabetes patients have their own glucose monitor, and so they're able to check their own blood sugar. But obviously, when they do their regular checkups, their blood pressure is taken. But I can't really speak to the kind of technology that's applied. Only that our experience is that the patients that we serve in our community who have diabetes get really good care, and are constantly, they're constantly in touch with the brigadistas, and they almost all the patients that we work with seem to be very happy with their treatment. There are occasional problems with medicine, because although MINSA tries to make sure that all the chronic patients, whatever their particular illness may be, in this case diabetes, they try and make sure that diabetes patients do get their medicine regularly. But our experience is that, especially in rural areas, we sometimes get requests from the medical staff that we know in those rural areas to help with diabetes medicine for patients. But in general, the ability of most of the diabetes patients, and I'd say kind of 9 out of 10, to monitor their own condition and be aware of their own condition, and to be alert to what they need to do if they suffer a crisis, and is very, very good. And so I'm sorry I can't speak to the technology aspect of that, but
that's very helpful. And I think because in the United States, believe it or not, diabetics often have difficulty getting insurance approval for their continuous glucose monitors. And they may have to go through all kinds of pre-authorizations and so forth. And I think because the questioner mentioned that they are a diabetic themselves and that it's very expensive, that the question is more looking at whether they have access to those kinds of monitors through the healthcare system free of charge.
Oh yeah, no, and if people need that kind of monitoring care, and I obviously I don't know for sure, but
right.
In terms of the overall philosophy of the system, they'd get access to those gizmos. I'm sorry.
Yes.
Free of charge.
Yes. Okay.
But it is a fact that I don't know what the cost of glucometers are in the US, but glucometers here are very cheap. And what people often find that they have difficulty with is that they'll have got used to a glucometer. They'll need to buy more of the sticks that you.
Yes.
And they'll go and they'll then find that the manufacturer has discontinued that model, and they have to buy a new one. But most people do who suffer from diabetes have their glucometer, and if they don't, they have ready access to a health post nearby. And one of the things that perhaps we should have explained is that the health system has a kind of hierarchy of care. So right at the bottom is the very local health posts. And for example, here, the health post for us is it's a 10-minute walk away. And wow. So that means that if somebody was worried about their blood pressure level and needed to go and take it, they could go to the health post. And it may even be the case that people have made arrangements to do that and do it as a matter of routine, perhaps not every day, but regularly with the health.
Okay, thank you. And it is helpful to hear about the hierarchical nature, which sounds a little bit to us like what we experienced in Cuba, those of us that went.
Yeah, it goes the bottom level is the health post, and that serves people in maybe 1 or 2 barrios. And then at the next level, you have the health center with the municipal health center, and that serves the whole municipality. And then you have a departmental hospital, then there'll be a regional hospital. And as part of all that is this incredible brigadista system.
Mm-hmm.
So the coordination between the different levels is very fluid. And I think that's And I don't know if Kensy and Becca agree, but I think that's one of the most striking aspects of our health system.
Another question specifically for you, Stephen. Do the drug traffickers interfere with the health system activities? Do you have safety issues?
No. And so far as I know, and it's just that I only mentioned that because it just seems to me so typical of the Nicaraguan authorities' creativity that, and they take these vehicles that they've confiscated and put them to use in the service of the people. And it's just, and no, so far as I know, there's no interaction at all, no negative interaction at all between organized crime and our health service.
Thank you. All right. So, Claire, do you want to go ahead and ask your question?
Sure. So, just in case everyone isn't aware, there's been studies in the United States showing that we have a great disparity race-wise in healthcare in the United States. And part of the problem is that a lot of Black people, for good reason, historical reasons, don't trust the system, and they particularly don't trust white health care providers, and frequently will not even go to them or not follow doctor's advice. So one of the things that has been helpful, was efforts to increase the percentage of physicians that were people of color. However, recently, things are going in the wrong direction for a variety of reasons I'm not going to get into. But I was just wondering, because I know Nicaragua has that whole section of Afro-Nicaraguans on one of the coastlines, and I was wondering if there was any effort to increase the percentage of people in the healthcare field, nurses and doctors, who are Afro-Nicaraguans. Because I know you talked about traditional healers, but I was wondering if there was any efforts to bring more people, more Afro-Nicaraguans or indigenous people into the healthcare, get training as doctors and nurses and other types of healthcare providers. I guess it could be Kensy or Becca. Either of you could try to answer that.
Rebecca. Well, in Nicaragua, education, it's free at our level. So you can decide to study the career you want to study. It's totally free. We have Afro-descendants doing, in every career you can find them. In medicine, we have, for example, the doctor in our community is from our community. And so we have the nurses from our community, and there is almost every Afro-descendant community staff in the health centers are they are from their community. So if you go to the hospital, you will also find Afro-descendants, whether you are in the South Caribbean coast or the North Caribbean coast. All over Nicaragua, wherever they study, they apply for jobs. There's no restriction not having them there. And of course, in our region and in our community, we are more happy to have our own people dealing with us because of the language and the way we see the world. So I hope I answered your question.
Becca, go ahead.
I just want to add to what Kensy said, that now that there's free education in Nicaragua, on the Caribbean coast of Nicaragua, there are wonderful universities that are training people right there on the Caribbean coast, which didn't used to be possible at all. So the Huracan and the Bicu are two universities, and at the Bicu right there in Bluefields, there is a medical school that's training doctors and nurses right there on the Caribbean coast to work on the Caribbean coast. So there's people from those communities going back to those communities more and more. And that's something that 20 years ago was not possible, and now it is. So that's a real achievement.
Thank you.
Thank you. Yeah.
Sally Roberts.
There we go. I was wondering, I was curious about the brigadistas and the levels of training they get, what kind of, what kind of skills comprise the unit of brigadistas that go out? Are they nurses, techs, just regular people, doctors? I'm just curious in the mix and the skill level, etc. And anybody who knows the answer is welcome.
Stephen, do you want to go ahead?
Yeah, no, I think all the brigadistas I know are ordinary people who are just very committed to their community, and they're also very committed to taking advantage of the different training opportunities that they get. So although they may not be trained nurses or trained paramedics, they're in a constant process of education. Sorry, as health promoters. And they, and so I don't know, I'd argue that the most important dimension of the brigadistas is their educational work in the community and their monitoring work in the community, based on the training that they are constantly getting from MINSA. And so, correct me if I'm wrong, Becca and Kensy, but my understanding is that the brigadistas are not trained specifically in paramedical skills, although they may have them, but they're not trained in those nursing and paramedical skills. And their main role is as educators and, as Becca described, being the eyes and ears of MINSA at grassroots level. That's how I understand the brigadistas, and that's my experience of them.
Thank you.
Would you agree, Becca?
Yeah, I would agree. Yeah.
I agree, and I must say that the brigadistas are always, they have their training that they receive to assist in education, health education, making consciousness with the people as they go in visiting, but they are never alone. They are accompanied by doctors or nurses in the process. It's like a teamwork, but they are their permanent accompaniment.
I see. Thank you.
But it's so important that everybody has that ability to be connected right in their community with somebody that they may know personally and have a relationship with. Okay, I'd like to call on Lee. I was about to read your question from the chat, but go ahead. I mean, from the Q&A.
Hi. Yeah. Can you hear me?
Yes.
Okay, I'm interested in knowing what is the structure of it? Is it hierarchical or is it more democratically structured? The administrative part of it, and how is it funded? I mean, is it funded by the government, and if so, do they do it through taxation, or just how is that set up? And then the structure or the way that it's set up, it sounds like the levels are, like in the neighborhood and then the city and then the region and such. But how are the administrators of those different levels chosen?
I can answer that. Yeah. So the question is the question about how it's funded. As far as I understand, the most of the funding for the healthcare comes from the national budget, and that's funded through taxation. In Nicaragua, we have a progressive tax policy, so that people who earn more pay more taxes. A novel idea, and so that's one way that these costs are covered. When it comes to larger investments for things like the building a new hospital, often those costs are covered through grants that are given. Sometimes previous to Nicaragua having sanctions placed on it, sometimes those grants came from places like the World Bank and the IMF. Now with sanctions on Nicaragua or illegal economic coercive measures, that means that Nicaragua doesn't have access to a lot of those loans anymore. So some of these hospitals are being funded by groups that are still willing to lend money to Nicaragua, such as the Central American Bank for Economic Integration. But every year Nicaragua loses millions and then billions of dollars in potential projects that could be happening and could be improving because we don't have access to these international organizations for funding thanks to sanctions. So it is important to note that we would be a lot further advanced in our healthcare system without sanctions. But all of these ongoing costs in healthcare come from within the budget of Nicaragua, and that's covered by taxation. So if Nicaragua, with its much smaller tax base, can cover the cost of free universal healthcare for its people, imagine what the United States could do.
I wish we didn't have to just imagine it. I wish we could find out. And what about the way that they're chosen, the administrators and such? Is that
I have to admit that I'm not familiar with the internal workings of the Ministry of Health and how they choose administrators.
Okay, thank you.
Maybe Kensy or Stephen can add to it.
Kensy?
Yeah, normally the ministers are appointed by the executive body, so they're the ones who choose ministers to take care of these different institutions. That's what I at least manage until now.
You said by the executive body?
Yeah, the president or co-president, that staff of the executive body, they would decide who will be the ministers. Not elected post, but is appointed post.
Can I add just briefly that and the health ministry has its bureaucratic aspect, and as Kensy says, the people who are appointed at the highest level in the health ministry are placed there by the presidency. But I think it's really important to understand the important role of FETSALUD, the Health Workers Union. The Health Workers Union has a very, very strong input into the way the health service is administered. They may not have such a strong role in terms of overall health policy, but FETSALUD definitely has a very strong role in the way the health ministry administers the system.
Thank you, Stephen.
I agree with you that they have a very important role in that, and they can make very good recommendations because it's their word. They have been following closely and totally involved here in Nicaragua for many, many years.
Yeah, and Kensy and Becca, do you think it's worth pointing out in this in relation to this theme, the whole idea of Pueblo Presidente and the way that the authorities are duty bound under the government's philosophy to pay attention to the feedback that they get from grassroots? And I think it's very important to stress that so that people don't get the idea that it's a centralized bureaucracy that isn't responsive, and the reverse is true.
I also think that we could mention that just like every other ministry, the health ministry does go door to door and do home visits every week. And they talk to family members in their communities and heads of household about issues that are coming up. So they are very present in the community. If something comes up, Stephen mentioned there's a health post, and each health post has a doctor and a nurse. And those doctors and nurses see patients in the mornings, but in the afternoons, they actually spend a lot of their time going door to door. They find patients who have dengue and have left the hospital without being released from the hospital to check up on them and see how they're doing, and things like that. So these at every level, people from the ministers down are going door to door and talking to people in communities. And then they take that feedback back up the chain, so that it actually is very, very possible to be heard in these communities. And as Stephen mentioned, the Pueblo Presidente, the people president model, has this back and forth communication from the grassroots right up to the presidency.
Yeah, and it might be interesting to see what would happen in the United States if President Trump started telling his ministers to get out and go door to door, because that's what happens here. The president actually gives instructions to ministers to get out and start seeing people, and they're actually told to do that.
I would tell you that in the Ministry of Health is so interested in the network that is there. In the farthest area of this country, you can even imagine that they take a case that needs to be attended quickly. I can assure you that no matter how far in the rural area that can be, it will be known at the highest level quicker than you can imagine, because it's a real strong and organized network that is there to save people's life.
So it sounds like there's just a total integrated quality assurance program that goes on from people to people and involves the administration, but it also is not only ensuring quality is being delivered, but also making sure that the healthcare that people are getting is doing what it needs to do, like making sure they've taken all their medications for an infection or something like that. So I think we have time for one more question. I see that Rita has her hand up. If you could unmute yourself and ask your question.
Hi, thank you. I was in Nicaragua in the 80s and was thrilled, and I worked in healthcare here and was thrilled to meet people in Ciudad Sandino who were running the health clinic there and saying how everyone there, whatever their background, was important. But my question is, I'm wondering if you're familiar with graduates from Cuba's ILAM, the Latin American School of Medicine. I know that Nicaraguans students have studied medicine there and returned to Nicaragua, and I'm just wondering about the role that they tend to play when they are back in Nicaragua in the health system. Thanks. Oh, and of course they get free medical training in Cuba. Thank you.
From around our communities here, normally when they come back to Nicaragua, they are they're part of the health program. We are very proud to say that our pediatrists here have got their free education in Cuba, and that's the doctor who is taking care of all of the babies of our municipality. So everybody is very confident and satisfied to have a specialist that was educated in Cuba attending children in our region. And there are many, it's not just Dr. Wesley, it's like there are many that have been there and got their education in Cuba, and they're back here in Nicaragua working in the health program.
Yeah, we know several graduates of the ELAM here in Esteli, and it's remarkable the way that they hang on to, or that they remain committed to the ethos of the medical training that they received in Cuba, because the temptation for medical professionals here is to get into the private sector and make as much money as they can. And so the influence of people who've graduated from the ELAM here in our medical system is not insignificant, and I think they play an important role in imparting the ethos with which they were trained and sharing that with their Nicaraguan counterparts.
So, Stephen, are you saying that there is a private system that exists separate?
Oh, yeah, absolutely. And as Kensy said in her presentation, if people want to pay for private care, that's up to them. Although the public system is really high quality now. And the main problem, as in all public health systems, is that people may often have to wait for the kind of, to get, for example, the laboratory tests that are available. For example, magnetic resonances, what they call them, CAT scans, that kind of thing. So, and people who feel that they need to have those services more quickly can get them in the private sector. And one of the things that is still something of an issue from our point of view is the fact that many of the specialists, not all, but most of the specialists in the Nicaragua's health system have private practices on the side. So in the morning they'll go into work in the hospital, and in the afternoon they'll attend to their private patients. Now, and there's always going to be people who abuse that, you know. But I think they're in a minority. Our experience is that most of the specialists that we deal with are very principled and pays a lot of attention to delivering the best care possible to their public patients.
If I could just add a bit to that, there is still there's kind of three levels of healthcare in Nicaragua. There's the public healthcare free for everyone. There's the Social Security healthcare for anyone who works and pays into Social Security. You get a different level. And then you get, then there's the private care. And one problem that we're seeing increasingly is that as the public healthcare quality has improved, the private sector gets more and more desperate to earn money, because even people who have the money to go to the private system often don't, because in many cases the care you get in the public system is simply better. If you can imagine doctors that don't have ulterior motives of any kind to sell you something else or to do another service, they're just trying to care for your health. And so the quality of the care in the public system is really good. And now what you find is in the private sector, you hear stories of people who are taken advantage of, told they have to do exams, certain types of more expensive exams, and other even operations that are unnecessary because of people, unethical people in the private sector trying to take advantage. So we also have to deal with the after 16 years of neoliberal governments, it was difficult to there was a time when people understood that if they went to, when the healthcare system was terrible in Nicaragua, it had been basically privatized, people learned that if you wanted your family member to survive, you had to pay money for it. And so there is still a mentality of, I have to pay money if I want my family member, the best care for my family member. And so sometimes people, especially very poor people, can be taken advantage of in that by that private sector. So we always recommend people to go into the public sector because it is much, much safer for everyone and really good care.
Can I just add? that although there is this level of the social security system, one of the advantages of the social security system is that people who have paid into their social security may well be able to avoid the longer waiting times that they'd have to deal with in the public system. But the level of care as such is as good in the public health system as it is in the social security system.
Well, these debate continuously in looking at what we're dealing with in the United States. And we recently had a webinar with Canadian physician and policy person, and they're struggling with not similar, but also a problem with privatization. And we have loved every minute of talking with all three of you and learned so much about Nicaragua tonight in this brief time. And so I just want to thank you all for coming, and a special shout out to Marty Schmidt for connecting us with you. She's been on the call as well. And I'm going to turn it over to Claire, who's going to do our wrap up.
Okay, well, once again, thank you, Kensy, Becca, and Stephen. It was a wonderful presentation. It made me feel like I hope I don't start something by saying this. It made me feel like I want to go to Nicaragua to visit your sister. That's what inspired us to go to Cuba. So I don't know, but yeah, I would love to go there. Okay, so just to remind those who routinely come to our webinar and those who are new, right now we're doing a campaign. As you know, this year's the 250th anniversary of the United States. And we have our declaration also. Our declaration is the Declaration of Independence from the Medical Industrial Complex. It's a petition that's both for individuals and then we have for organizations. And we are hoping, right now we have 689 as of 6/13, as of June 13th, we have 689 individuals that have signed on to the petition and 71 organizations. We would love to get thousands, and I'll tell you why in a minute. So please, those of you on there, go to our website, nationalsinglepayer.com, all one word, and you'll see it right there when you go on. You'll click the QR code, or actually on the website, it'll have links where you can sign in if you're an individual. Tell all your friends, family members, everybody you know, click on and sign. And if you're in an organization, get your organization to sign on too. When you do that, what will happen is we will contact your congresspeople and through their legislative directors to let them know you've signed on, how many people in their district have signed on, and invite them to a national town hall that's October 14th. We're hoping to make it a really big town hall in which we're going to have lots of congresspeople there, and we're going to hold their feet to the fire to not only sign the Jayapal bill for national single payer health care in this country, but also to campaign for it, to fight for it, and so on. So this is the town hall that we'll be having in October, but we need to get hundreds, hopefully thousands. Well, we have hundreds already, thousands of signatures, maybe more, to help make this an effective campaign. So nationalsinglepayer.com. Some other things just to make you aware of. I've already said we have our website. If you like this program, please donate to National Single Payer. You'll see on site where you can. Sign up for our monthly newsletter. A recording of this video will be available soon on our website. And also, we have working groups every month. The next working group will be July 8th, where we work on whatever campaign we're doing right now. And right now, that's the National Single Payer, the Declaration from the of independence from the medical industrial complex. So we invite you to come to our website, our working group. It will be published on our website, where we will discuss how we can make this campaign even bigger. Also save the date for another possible webinar, July 22nd. And also save the date for August 15th. We'll be having a webinar with Doctors Against Genocide. Okay, so thank you everyone for coming. We hope you'll come back to our next webinar and to our working group, and we hope you'll bring some friends with you. And once again, thank you very much, Kensy, Becca, and Stephen. It was a fantastic presentation. Good night, everybody. Okay.
Good night.
Good night.
Good night.
Thank you, everyone.
night.
Good night.
Good night.
Good night.